How effective is the Sterilis device? With Kip Thomas, Ph.D.
I became aware of Sterilis in the process of working in the emergency management field. I became involved in the process of evaluating their technology by looking to determine whether or not it was able to accomplish what it had identified itself to be able to do, and to validate that it actually was able to create the levels of decontamination that it was reported to have the ability to do. Currently, the mechanisms for dealing with medical and hazardous waste is to store that waste. If it's collected at a hospital, the waste is taken at the point of generation of the waste, and then it's moved into a storage area in the facility. So not only do you have the potential for decontamination issues in the transmission of the waste from the collection point to the storage facility, but also in the process of moving the waste. So if you're a hospital, you have the responsibility to maintain the legal liability for that waste until it's ultimately destroyed. And that might mean that the waste isn't in your control when it happens. So in the design of the Sterilis device, they incorporated all those components to meet the regulatory requirement in its interface. So when you go to the device and you enter the information in about a particular set of waste that you're disposing, it actually tracks that information, creates a record, and sends that into the cloud. So not only do you have it there, but you have it electronically and saved in a backup immediately. So you really have a much more resilient way to track and maintain the pedigree of your hazardous waste. They've come up with really, I think, user-friendly interfaces, including its ability for you to access the machine through touch screens and on-screen guides on what to do. I actually had the opportunity to test some of the material that was put into the device and validate that it actually did render, through our testing, everything in our. Looking at this device made me realize that this was worthy of publication. It was worthy of a novel new way to deal with the medical waste problem that we have. For large-scale waste, you still will need incinerators, and you'll still need on-site storage until you can dispose of this. But with respect to the generation of waste that are routine or that come through normal patient care or through patient care that would be required at the bedside, this really is a very, very critical component of the new way that we can deal with this medical waste.